mental health problems of today can become the chronic diseases of the future. Does Finnish culture encourage people to consider suicide?
Is there a crisis in Finland? Welcome to our podcast on chronic stress. I'm Riona and I'm here with my dad.
I'm Colin.
Why did we start this podcast?
So my interest in the effects of chronic stress on the mind and body stems from my own real-life experiences from trauma and also my struggles to cope with the aftermath of that. So I was exposed to multiple traumatic experiences many years ago, and I have also experienced the mental health, the healthcare systems in Finland over the past 4 years, trying to get treated for these issues, which I'd suffered from for many years. So one of the biggest mistakes I made in life was not telling my family anything of what I had been through. I suppressed everything, kept everything secret since my mid-20s, and that may become the shock of still some members of my family. So I've had a lifetime of burying my experiences, all my pains, my guilt, and every other feeling and emotion that accompanies traumatic experiences. So I discovered through my own research that suppression of emotions is one of the worst things a person can do for your mental and physical health because of this chronic stress. So I want to share this research with whoever wants to listen. Chronic stress can damage our brain and body. It is a hidden killer and potentially affects many of us, and we need to know why.
Yeah, so obviously I'm your daughter, but I had no clue. You just managed with it and suppressed it, like you said, very well. And you were always, in my opinion, like you can be pessimistic, but one of the most optimistic people. And then what changed is you started going to therapy. And then after therapy, you opened up and then we started to really talk about it, really, didn't we?
Yeah, I guess it took me to become divorced and become separated from the family, to maybe spend time and go through therapy, do a lot of self-reflection in tandem with the therapy, going back and forward and realizing that I needed to surface everything, get it out there on the table, get it processed in therapy, and somehow get back to a normal life. I guess what was going on in my mind and inside was chaos, and on the surface, I just tried to be as happy-go-lucky as maybe people would ever see me for. But yeah, I hid a lot, and I guess it took the therapy to get it out, get it processed, and get it out of my system. And thankfully, that's why I'm here right now.
And just to clarify, you went to therapy in Finland?
Yes, I had nothing in previous countries where we were living. So,
and how long did you have therapy for in Finland?
About 3.5 years.
Is it still ongoing, or you don't go as often, or you quit altogether?
No, the therapy itself ended. There's still some issues that come up, but my therapist has been very kind to me, can still provide some pro bono work when I need it. So that's really a bit of a godsend. So if I have an issue, I can still go to him, and he very kindly can process things that I need to have further processing.
Yeah.
One of the things about trauma is when it happens to you, I don't care whether it's childhood trauma or trauma from terrorism or whatever, from war, whatever it is. One thing about traumatic experiences, you can bury it so much that it's out of your mind, and it's something you might not remember because of the traumatic experience itself. Dissociation, you may blank it out in such a way that it's just hidden, but it may just crop up years later when you're just sitting there, and it'll just intrude.
Crop up.
Crop up.
Creep up, yeah.
Creep up, yeah. It just sort of emerge unexpectedly.
Yeah. So I'm next to go to therapy. Do you recommend it for everyone? Even if you're not aware that you've got any stresses or trauma?
If you're suffering from some sort of mental health issue, which impacts your functioning in life, such if you feel like, I don't want to go out and face the world. I don't want to face people. I want to stay at home. If you feel you're isolating yourself, you're deliberately staying away from crowds or groups, people in work situation or whatever it is, you may have some underlying mental health issue. I'm not saying that everyone with these issues needs a therapy, but I know it'll help you if you're able to discuss with someone. It doesn't have to be a therapist, but if you're really suffering that you can't function in normal life and work, I would suggest, you need to go and speak to a medical professional, discuss your issues, and see what they say. They may say, well, okay, this is normal or blah, blah, blah. But some general practitioners will be highly aware of the mental health situations going on in somewhere like Finland. So they can say, okay, I think you should go and see such blah, blah, blah in this health center or this acute adult psychiatry or child psychiatry. They should be able to point you in the right direction.
Well, that's the thing, because I think I would like to go to therapy, but I remember living in the UK, I think the waiting lists to go and speak to a psychiatrist was like sometimes 6 months. So it's kind of like you're stuck for 6 months. People commit suicide in that time. Sounds horrible, but it just, the waiting list was just so long. But then that's a whole other issue. I don't know if they had enough professionals, or was there just so many people struggling? I don't know, but...
Well, this is why I say there's a crisis in Finland, because there are many people who can't afford to pay privately. There are many psychiatrists in Finland. I think there's something like about 6,000 psychiatrists, psychologists who offer these type of psychotherapies, amongst other things. But my knowledge is that if you have money, you can probably see a psychiatrist pretty quickly because you're willing to pay. And if you have a good company, if you're in work, you may also have access to occupational therapist, psychotherapy. So money is a thing, but there are many people,
unemployed people, who are stuck in that cycle.
Unemployed people, and also people on low salaries.
Yeah.
There are many people. I've spoken to quite a few people, again, lots of younger ladies. They're waiting to get into therapy because they're making applications, and some of these people have had therapies before, so it's very difficult. I'll come to that a bit more later today about this issue, but it is a major problem anywhere in the Western world. So I think if you don't have money or you have low income, it is a major problem for many younger people and people suffering from mental health issues. It is.
Yeah.
And that's part of the crisis.
Definitely. I suppose nowadays they also have, you don't have to go in-person therapy. They have stuff online and stuff like that. But then again, I don't know how effective that is. I suppose that's easier to maybe get time. Expenses, I don't really know.
From what I understand, it's being offered more and more in places like Finland, of course. And there are distance sessions and there are different techniques for doing that, depending what the issues are. So I'm aware of that. And I know that they're trying to encourage more of that. And of course, that's one way of saving cost and being able to handle more people. But the fact is, some people's mental health issues are so sensitive, they don't feel comfortable sharing that over some sort of media, which they may be recorded. So to me, that was one of my issues. I didn't want to be recorded over internet, things I was going to be sharing. So I needed to have the face-to-face, in-person stuff. So that's another factor. But of course, younger people feel more comfortable about doing stuff like that. So I think for younger people, it probably suits. But for older people, maybe not.
Yeah.
But for sure, it's an option. Yeah.
There was also, I saw somewhere, must have been in the UK, that they had pop-up therapy. So they'd have a pop-up store with therapists that you didn't have to book a time for. You could just walk in, have a session, walk out. But then I wonder how helpful that actually is. I know sometimes it's nice to just talk to someone if you really have that sort of like panic attack moment that you really need to speak to someone. So in a sense, I think it's a good idea. But then at the end of the day, how much is that one session going to help you? Because I would imagine you need to establish a relationship with the therapist as well, to trust them to be able to open up.
Yeah, I think in much of the literature about good therapy, that element of trust and building a relationship between the therapist and the patient is, of course, is very crucial. So I know that for sure. And that was one of the things that helped me. Only at that point, whenever I was able to open up and trusted the therapist, that's when everything started really working fast for me. So I know that. But I must say that that would be a good option in Finland if there was pop-up access to therapists, so that if someone was struggling, they could go and at least have a chat with someone who was well experienced in the current situations in Finland and more aware of what young people are suffering. That would be a great idea. I don't know if it's actually happening. I haven't heard about it. But that would be a good way to do it, so that people would understand, do I need more therapy? Of course, they're unlikely to unload or surface their main core issue that's really bothering them. If it's something that's maybe they've suffered in childhood, it's really, really sensitive.
I mean, people open up to, let's say, TikTok these days with very personal things. And I suppose that's a form of therapy, because then it reaches an audience that might have experienced the same thing. And then people comment and you maybe start a community where you can discuss these things. So if people are willing to open up on social media to people they've never met, then pop-up thing could work, to be fair.
Yeah, I mean, I think that's one of the things about therapy is opening up. You have to give it a name. You have to sort of make it a target for the therapy, which is what I had in EMDR, eye movement desensitization and reprocessing the therapy for PTSD. That's how they process it. So you have to make it tangible. You give it a name and then you sort of say how bad it is, and then it process it using the technology.
So you have to admit you've got a problem.
Well, of course. I mean, that's the key point. First step is reaching out, talking to people that you've got an issue. Go and speak to a professional. Professional maybe ask you more questions and try and identify what the issue is. And from that, then it becomes like, okay, this issue needs to be processed in this way or the other way. So that's for sure. I mean, obviously psychiatrists can talk about that in more detail, but to me, that's the key point. You have to be able to get it out there, make it tangible. Yeah, talking about it online may help, but to me, the problem with talking about it online, is it a one-way process? You need to have dialogue.
Yeah.
You need to have that curation where someone's giving you feedback, and if your perspective is maybe too negative or a wrong perspective, when I say a wrong perspective, it's your perception may be too much slanted by your thoughts and your perceptions of I've done something wrong or I should have done something in a certain way. So you need to have that curation from a therapist, someone professional, to give the feedback to sort of edit and amend your perspective so that it comes around to a less negative view about yourself. So you don't have bad self-esteem. You're not feeling bad or guilty or shameful about those thoughts or about those perceptions. So the therapy helps to give that a new perspective, and that's what the therapy tries to do. It changes your perception and makes you feel less negative and stop beating yourself up about these issues. That's what the therapy really does, and it gives you a more positive, futuristic outlook rather than dwelling in the past. It brings you to living in the present, so you can go on in life.
Okay, yeah.
So so online is good, opening up, but if you don't have that curation from someone who knows what they're talking about, it could be damaging. It could actually increase your level of negativity, lower your self-esteem and others. So it's something that needs to be treated with caution and be very careful with. So maybe is that one of the issues with online media, that people don't get the right feedback and the dialogue? They just get the negative, like they say, the echo chamber.
Yeah, definitely. I think you can go down a rabbit hole of it's your phone, it's your social media. You decide what you're watching. And then once you get into certain type of videos, then that's all your algorithm shows you. Maybe more pointing to negative thinking.
Downward spiral.
Yeah,
not
for sure.
good. Not
Goes
good.
both ways. But yeah, so you mentioned there that you've got your own experience with PTSD. You went to therapy, but you're not actually a doctor.
No. So, well, I guess if you think about what knowledge do I have for this type of stuff, well, I have a PhD, but I'm not a psychiatrist. Let's make that clear. But what I bring to the table is approaching this subject from real life lived experiences. As I said, I have PTSD, post-traumatic stress disorder. So I have deep insights from my traumatic experiences and also the treatment in the mental health system, and also as a peer supporter of many other traumatized people in Finland suffering from chronic stresses. So, of course, whenever I conduct research, so I'm basically a researcher, I don't simply follow the perceived wisdom blindly. I dig deeper to better understand or even question the claims when they clearly don't follow real-life lived experiences. So I follow the empirical evidence from different perspectives: psychological, physiological, biological, neuroscience, and many other areas, to arrive at a multi-dimensional picture of what's going on. But the crucial point is I'm doing this over time. So I'm trying to look at what happens with these different elements over time. Now, this is really crucial because the impacts of chronic stress only tend to show up many years later. It's not something like, oh, I had a traumatic experience and I have a disease like within a few months. No. We're talking about chronic stress. It's something that happens over many years, and the diseases probably don't show up for them, but that's the fact of life. But the good news here is because it means that we can intervene psychologically to change potential problems before it gets to that bad stage of developing these chronic diseases.
So in this episode, we're going to give an overview on chronic stress and what the situation is in Finland. So what exactly is chronic stress?
Stress is a particular relationship between a person and his or her environment. So it's appraised by the person as either demanding or exceeding his or her resources, and also has an element of endangering his or her well-being. But it's not just the mere occurrence of a challenging experience alone. That's not enough to induce stress itself. It is actually the individual's interpretation of the stressor which makes the difference. So it's not just about having a traumatic experience. It's also things like your upbringing, your parental experiences, and your environment as you're growing up. That it can also create much more of the terrible effects of chronic stress. So to experience stress, a person must appraise the event or the experience as something which is threatening or harmful. So it is the appraisal of the experience and not the emotional reaction at that time. So that determines the subsequent physiological and the behavioral responses. For example, the person assesses if their coping strategies can handle the situation, or if the problem is something they need to accommodate and accept. I can do nothing about this. I just have to accept it and move on. So some models of chronic stress, what they call the allostatic load model, so that proposes that psychological, demographic, background, environmental characteristics all contribute to the perception of an experience as a stressor and something which threatens a person's what they call homeostasis. Homeostasis is basically the range of normal functioning in the body, so your heartbeat, your temperature, and stuff like that. And the allostatic load model, allostasis is something whenever your body's very stressed, it moves up to different ranges. So it's not normal, it's above normal ranges, and your body just learns to cope with that. So while this physiological arousal is very adaptive whenever you're dealing with a stressor in the short term, the long-term activation can have very negative effects on many other physiological response systems, such as the immune system, the metabolic, and the neurological changes. And that can lead to behavioral changes, cognitive deficits, and also vulnerability to many diseases. So if you like, chronic stress is the chronic wear and tear on the body and the brain. So in other words, prolonged stress causes damage to your body.
So would you say the difference between stress and chronic stress is the amount of time you've been stressed for many years of your life.
Yeah, that's a good question. I don't think we can put a exact time limit on it or duration, but it's more the prolonged level of stress which keeps you stressed at above sort of the normal ranges of basic stress. We can all have stress from, we're going to make a presentation, we're going to have an exam, we have a life situation, you need to go home and do stuff because your parents are giving you a bit of grief, your room's not tidy. So those type of stresses are normal. But it's when things go well above that which keep you stressed out. For example, it's more the psychological stressors, like if you're in maybe a bad relationship, you could be suffering some sort of abuse, domestic violence from a partner. You could be suffering grief. You could be having many problems in life, and they all just mount up. So that prolonged level of stress is quite different to normal stress. So we're not talking about the temporary stress of normal living and normal life. Stress is good in that way. It helps us to focus and do things maybe we need to do. But those prolonged stressors, they can be days, months, weeks, but I'm talking more like months and years is pretty much the prolonged stress, chronic stress represents.
Okay. So quite a few people experience burnout at a certain point. Would you say that is the effect of chronic stress? You reach a certain level that you just burn out?
Yeah, I would say that is one element of chronic stress that can come from many, many things. And I think people may see that as more related to work, that type of stress. But I think maybe burnout is maybe a symptom of many other stresses. And I think that's what's probably not well known, is that maybe burnout is, wouldn't say the tip of the iceberg, but maybe the symptom of an underlying issue. Chronic stress of work just adds to it. So it's maybe the last straw that breaks the camel's back.
Yeah. And so someone experiences burnout and they have to take a break from work. Are they right to take a break? Is stress actually, is it all in the mind, or can it actually be something physical?
For me, it's not all in the mind. So I would say no, it's not only in the mind. It can cause physical changes and damage to the human body. So there's actually a growing body of research has emerged demonstrating the effects of chronic stress on the brain and the body. So like I've said, or tried to intimate earlier, the normal stress of life help us adapt throughout our lives. But whenever these prolonged stressors become chronic, then this elevated stress response system can have damaging effects on the cells, tissues, and vital organs of our body. The effects of traumatic stress on the brain are actually well documented since the 1980s. Some studies from the Holocaust survivors during the Second World War, Vietnam War survivors, and also these famous adverse childhood experience studies in the 90s. And what they showed was the damaging effects of trauma on the brain structures and the behaviors of sufferers. So what we know is that because your brain is developing during childhood, for example, much of the brain structures develop in the first few years, but your frontal cortex does not develop until your late adult or your late adolescence and even early adulthood, maybe until your mid-20s to late 20s. So a lot of stuff that happened in your childhood can actually affect how the structure of your brain and how it works and how it's wired. So we know that already from what they call functioning MRI studies. That's helped give a picture and insight into what's happening with the structure of the brain. So over the last 2 decades, this new body of research shows that prolonged chronic stress can have an even more insidious effect, severely compromising the brain or the body's stress response and immune systems. And that's a fact that is shown now in research. Empirical evidence is there.
Yeah, it's interesting. I suppose every time I've noticed that I've been stressed, I don't necessarily realize it until I have some physical symptoms. because of the stress?
Yeah. So when we talk about those temporary sort of short-term stress responses, so when your body starts reacting to some stressful situations, it starts releasing lots of chemicals, things like what we call cortisone and stuff like that. There's also adrenal from adrenaline gland. But if you think about those chemicals and those stress hormones which have been released, whenever they're circulating in your body for a long time, you can feel them initially, but over time, if they're prolonged, they may settle down a bit, but they're still elevated, but they're having a damaging effect inside your body and in your brain. So that's what we know now. So a lot of those stress hormones, they're good in the short term, but long term, they're damaging to your body.
Damaging, yeah. So it's happening internally, you don't even notice it.
Exactly. So very insidious, very gradual, kind of like, I don't want to say eating away, but it's kind of attacking the body's own immune system, all these different elements of your body.
Could it even be you realize it, or it's you're getting ill more often, but then you just put that to other things? So you actually do notice the symptoms, but you don't realize, you kind of just get used to it.
Well, that's one thing about chronic stress. People ignore those symptoms. They may come up in different ways. We go to the doctors, we go and get checked out, but we ignore the long-term effects of all these gradual accumulations of stresses in the body and in the brain. Most people don't. They may go to the doctors and they may go and get checked out, but then the doctors, of course, they're listening to the symptoms, and of course, they're not listening to your whole life story. So when we talk about chronic stress, it's all about your life history of many things accumulating. That's quite different approach to current medicine, maybe even many areas of psychiatry.
Do you think these days, if you compare it to when you were younger, do you think people are less or more so likely to sort of complain about it or take a break from work or that sort of thing? Do you know what I mean?
Whenever you read studies about chronic stress, there are a long history for 100 or more years, since the Industrial Revolution. There were people commenting on, oh, the stress of life is increasing because of all these new technologies. That's been an ongoing debate for the last century and more. So I'm not sure I can say these days we're under more stress from the environment. I don't know if that's the case. I mean, I know there's studies talking about more chemicals and stuff like that, and maybe the growth of cancers, and the debate that is it because we can detect more cancers and stuff like that. I'm not so sure, but I think the evidence is showing now that we have different types of stressors. Maybe the human body is not just adapted fast enough in our evolution. I mean, a lot of the stress that comes from in human, life, it helps us adapt, and that's the reason why we dominate the world, is because we've learned to adapt to so many habitats around the world.
So what diseases or disorders are actually linked to chronic stress?
Well, there's a growing number of studies that now indicate that chronic stress is a major contributing factor in the etiology of many chronic diseases, and these include things like diabetes, asthma, breast cancer, lung cancer, Alzheimer's disease, many rheumatoid conditions such as rheumatoid arthritis, MS, multiple sclerosis, ALS, maybe in Finland people call it ALS, but it's amyotrophic lateral sclerosis, which other people call it maybe in the States motor neuron disease. And there's many other conditions like that related to chronic stress. So what is really striking from these studies showing the evidence of this psychological relationships between chronic stress and the development of chronic diseases is that the psychopathology invariably stems from early life experiences and continues into adulthood. So crucially, the psychopathology identified in these studies can be interpreted as what they call defeat and entrapment. So this is something that's well documented as a factor in depression, anxiety, PTSD, post-traumatic stress disorder, psychosis, schizophrenia, etc., and also, importantly, hopelessness and even suicidal behavior. So that's something we'll cover in detail in further episodes. But for now, when we talk about this entrapment, it's something which psychologically impacts us and makes us feel in a hopeless situation, which we can't escape from. And that leads to a lot of these mental health issues. But crucially, if it's prolonged, it can have devastating, damaging effects on the body and the brain.
So why is this issue relevant in Finland? Is everyone in Finland stressed?
Okay, to answer that, first of all, the subject is important in Finland because of the current mental health situation, especially among young females who increasingly experience high levels of mental health problems. For example, in 2018, some 90,000 children under the age of 13 were suffering mental health problems, and that's before COVID, remember. But also, just after COVID, like in 2023, one study showed that 56,000 girls between 13 to 20 years old had at least one mental health problem, while some 37,000 of these girls had comorbid mental health problems. That's one or more, so mental health issues. To add to this, over 40% of students now report some sort of mental health problems. Even very recently, in 2024, Kela recently reported sick leave costs from mental health have grown substantially over the past decade, from €500 million to something like €1 billion. Secondly, the subject is important in Finland because females generally account for most of the suffering of the diseases linked to chronic stress. And I'll give you some examples here. There's something like over 400,000 type 2 diabetes sufferers in Finland. And of those, the higher prevalence is among women. That's a fact of life in many countries. There are also something like 45,000 sufferers of rheumatoid arthritis in Finland, and 2/3 of those are women. Now, if we look at something like multiple sclerosis, there are something like 12,000 patients in Finland. Again, more than 2/3 of those are women. Okay, now let's look at the other things that people maybe relate to more to women. So breast cancer. There's something like 900 deaths per year, but there are like over 5,400 new diagnoses every year in Finland. And what's worrying is that, generally speaking, the incidence of cancer and mortality rates are higher for people with basic education and lower for people with higher education. But in breast cancer, the reverse is true. So that means women who have higher education are more likely to be suffering breast cancer, which is bizarre. Okay, now lung cancer, we have something like over 3,000 cases per year. 1/3 of those are women. But the worrying trend is that there's steady growth among women getting this lung cancer. And bizarrely, even 100 cases of non-smokers. Now, we can say that might be passive smoking and stuff like that, but I think the evidence is pointing in other directions. When we get into the podcast episode on lung cancer, I can talk more about that. But actually, lung cancer is the second highest mortality for women in Finland. There's something like 900 deaths per year from related cancers. Okay, finally, some 40% of females over the age of 65 have Alzheimer's in Finland. So that there's something like 150,000 people with memory disorders in Finland in 2021. But it's something like 22,000 new cases every year and 12,000 deaths. 2/3 of those, again, are women. Now, it's already been estimated in Finland that by 2040, about 250,000 people will have Alzheimer's. So I think from this sort of these sort of figures, I just think that's really striking and quite a worrying trend if we think about how it's impacting women.
There definitely is a crisis in Finland, but how would you maybe compare Finland's situation, mental health situation, to the rest of the EU?
So if we think about the mental health situation in Finland, so Finland has one of the highest incidences of mental health disorders in the EU. I think something about 20% of people in Finland suffer mental health problems during their lives. That's a simple fact. That's the big problem. So as I say, it's one of the highest in the EU. And the economic cost of dealing with mental ill health was estimated at something like 11 billion euros in 2015. Now that's going back over 10 years, which already then was 5% of GDP. That figure is going to be much higher nowadays. As I said earlier, in 2018, it was reported by ULI 90,000 children under the age of 13 were suffering from mental health issues. But as recently as this year, the University of Eastern Finland reported that more Finnish children than ever are accessing mental health services. Anxiety and behavioral disorders are common conditions in children under 10 years old. And also between 2007 and 2017, the number of psychiatric outpatients grew by something like 65,000. And in 2017 alone, 190,000 patients use psychiatric outpatient care, with another 25,000 receiving hospital care. So that's checking themselves in or being checked in. And that's from a study in 2021. So the mental health problem is just growing and growing. Like I said earlier, Kela announced in 2024 that the mental health sick leave now, it costs Finland 1 billion euros annually, and that has grown over 10 years from $500 million. So that's the mental health situation.
So what's the mental health therapy like in Finland? Do you think it's effective enough?
So each year there's something like over 50,000 patients receiving psychotherapy rehabilitation in Finland. But this number actually excludes visits to private psychiatric care or psychotherapeutic services. So that private side, like I talked, people with money can access that. But anyway, based on those 50,000 patients receiving psychotherapy rehabilitation in Finland, the research suggests that the health benefits of a large proportion of the visits to outpatients clinics may be questionable due to the lack of intensity, specific treatment plans, and so new patients may not receive care they need, resulting in shortcomings in terms of recovery, sickness, absence, and disability. And that's from a study by Korkeala in 2021. What strikes me with this research by Korkeala was that 50% of staff input in outpatient clinics is focused on patients receiving treatment for several years. So there's no quick fix for many, many sufferers. And I can say that having benefited from 3 years of trauma psychotherapy myself, I understand that cases can be highly complex and to treat and also involve multiple issues, as I had. But on the other hand, as a volunteer peer supporter in Finland for people suffering from traumatic stress, PTSD, trauma and stuff like that, I noticed that nearly all the persons I have supported or chatted with, sooner or later, they tell their life stories, detailing a litany of numerous therapies and treatments which have never actually processed their primary issues, which seemingly stemming from their childhoods. I never ask questions about what happened, but I can read between the lines. But at the same time, they're telling me that they've suffered quite serious issues in their childhood. Somehow, their treatment in therapy has never actually delved into that and surfaced it enough to process it. So I've been asking myself, is what I'm experiencing here unique, or is that symptomatic of an underlying problem? And I think it actually is the tip of the iceberg based on what I've seen in my own research about the mental health situation in Finland.
Yeah, I think it would be great to hear from anyone who's listening to this who also lives in Finland what their experience is with similar sorts of therapy and therapists. It sounds like there's definitely improvements to be made, but it'd be great to hear. what other people's experiences have been.
Yeah, I think it's very important to get some feedback from people. Of course, what I've experienced has been, on the whole, very good, and I think I've been lucky to be in a situation where I've been having good access to good therapy in Finland. So I think we are, shall I say, blessed by professional therapists here. But clearly, there's a lot of room for improvement. Like in all things in life, we can all improve a situation. But I have to say this, that just saying that, this situation reminds me of what that Hollywood actor Jonah Hill said. You know, he did this Netflix documentary on mental health.
Oh yeah, the
with
one
his
called
therapist.
Stutz, I think.
Stutz, was he some sort of Jewish
therapist? Yeah, that was the name on the documentary. And if anyone wants to go watch it, it's called Stutz.
Yeah, that's very good. And I think Jonah he takes things very comically, but I think, I know that from my own experience, that sometimes people with a sense of humor, you think about Robin Williams, who sadly committed suicide, another actor who always seemed to be funny in the life and soul of a party, just like Jonah. But of course, Jonah was in therapy. So what Jonah said, and which I think is hilarious, he says, you know, it is funny how the people with least knowledge of psychiatry, such as your friends and your family, are the most willing to give you advice for free. But the people with the most knowledge of psychiatry, you know, the psychiatrists, are the least willing to give you advice. What's more, you pay for this. So anyone that's been to psychiatric therapy maybe can identify with this. But okay, whilst they're in this sort of humoristic interlude, I can say there's another joke that I found many years ago, well, a few years ago. This goes by and says, a neurotic is a man who builds a castle in the sky. The psychotic is the man who lives in it. But the psychiatrist is the man who collects the rent. That's bizarre, but I mean, I think it's tongue-in-cheek slight against...
Dad joke.
A dad joke, yeah, maybe so, but at the same time... So it's, like they say, there's no smoke without fire. So psychiatrists do have an important role. And of course, we can all improve. Even as patients, we can improve. So it's up to us to get ourselves along to psychiatrists and open up so that they can actually deal with our issues. But yeah, there's room for improvement in psychiatry, for sure.
Well, I guess the hardest part is actually booking an appointment and showing up.
Well, the first point is admitting to yourself that you need some psychiatric intervention or some support for your mental health issues. And I think you need to speak to your professional to understand the level or the situation or the degree of issues you have. So if you're feeling that way inclined, I think it's good to get advice.
Yeah, definitely.
Joke aside, I was digressing there a little bit, getting carried away. So if we return to the mental health issue, there was also a recent Nordic research project studied the mental health problems of Finnish adolescents aged between 13 and 20 years of age. That was looking before, during, and after COVID between 2015 and 2023. So this study found the proportions of people experiencing generalized anxiety, depression, social anxiety, disordered eating, suicidality, or self-harm. Actually, all these type of things increased from pre-COVID levels, but remained consistently high in 2023. That's a study by Givorusu and others in 2024. And in fact, something like, as I said earlier, 56,000 girls had at least one mental health problem in 2023. Boys, it was something like 23,000. But some 37,000 girls had comorbid mental health problems. And the authors of that study said this was alarmingly high for girls. So it's not me saying, I'm reporting what the research studies are saying. And from another study of Finnish children and adolescents aged between 0 to 17, that study compared psychiatric diagnosis before and during COVID, during those essential years, from around 2017 to 2021. And that study found that during that period of major restrictions, there was particularly high increases in eating disorders, depression, anxiety, and also neurodevelopmental disorders, especially amongst young females and adolescents. And that study was published in 2023, Gulenberg and others, and I think that's from the University of Turku, that study. So if I was trying to sum up the mental health situation, what I can see is that the research regarding the development of mental health problems during COVID is interesting because it reflects those stressors and stress imposed by severe restrictions on an individual's movements, which the authors of those studies suggest could be associated with psychiatric problems at a later stage. Actually, in fact, I will show later in other or subsequent podcasts that the issue of psychological immobilization or entrapment, as I said earlier, is highly influential in the development of mental health disorders as well as many chronic diseases. I think for me right now, when I'm trying to sum up the situation, the mental health situation, the problem right now is the current view in Finland that there is no mental health crisis, despite all the evidence suggesting otherwise. Now, I've recently seen an article in Yle. I think there was one study by one of the researchers in Miele saying that there is a mental health crisis. So that's something that people can look up online if they don't believe me. But for me, what is so dangerous for the lives of people and costly for the Finnish economy and the healthcare system is that whenever you downplay these prolonged stressors in mental health of the young people especially, that risks ignoring the underlying health problems of the future. So the accumulation of chronic stress in individuals' bodies contributes to chronic disease, as I've already highlighted. So to me, that's the worrying point, and I think that's the key point we have to take away here. That mental health problems of today can become the chronic diseases of the future. So that is a lot of cost and a lot of suffering for people. So why not intervene more proactively and resolve a lot of these mental health issues, particularly in younger people right now?
Okay, so how do mental health problems then influence diseases?
This is really a highly complex subject, and answering this question is really best handled by focusing on each different chronic disease or disorder. And that is what we plan to do, I guess, to present in subsequent podcasts. But for now, if we let's just consider the health damaging behaviors people adopt in stressful lifestyles. So that gives us some feeling for what's going on. So the most common stressors are ones that operate chronically, so often at a low level, and that cause us to behave in certain ways. So for example, being stressed out may cause us to be anxious or depressed, to lose sleep at night, eat comfort foods, and take in more calories than our bodies actually need. We can even smoke or drink excessively, well, too much. If you think about the takeaway food culture today, you may be asked, why is it growing so fast? Is it internet the sole responsibility of that? Or is it because there's a bigger demand? So like we said a bit earlier there, so eating more and drinking more, smoking more, and doing a lot more of these things, I would say, I even argue, that's one of the reasons why we have this takeaway food culture and many other service industries doing so well in the Western world right now. People want to eat and drink more and snack more. So no surprise, our high streets are full of all these places, coffee shops and eateries and you name it. And then the takeaway food culture, we can get just about everything delivered to our doorstep within 20 minutes. Anyhow, being stressed out may also cause us to neglect seeing friends. So we isolate more, or we may take off more time from our work or reduce our physical activity. So that's another way we react to being stressed out. Another way is that we may take more medications to help us sleep or to help us cope. And through time, our bodies may increase weight and develop other symptoms of an unhealthy lifestyle. So I have to add to that, it's not just taking medication to help us sleep and help us cope, but many people will take more alcohol. They might take other type of medications to make them feel numb and stuff like that. I'm talking about people who are suffering major mental health issues or prolonged chronic stress. This is another way of dealing with it, just trying to cope with it. So I guess whenever you think about all those things I've just been talking about there, the listeners may already see that these behaviors, if they're prolonged, they can lead to things like obesity. And of course, many of these issues potentially lead to something like type 2 diabetes, cardiovascular disease, atherosclerosis, the hardening of the arteries because of cholesterol, etc., and stroke, and many other things. But this is only one impact of chronic diseases.
So how does this manifest in Finland?
Okay, well, in Finland, in 2019, it was estimated that about 35% of the deaths could be attributed to behavioral risk factors such as dietary risks, smoking, consuming alcohol, and low levels of physical exercise. Something like about 20% of adults in Finland reported being obese in 2019, which was a higher rate than most EU countries. And you compare that to the year 2000, whenever the figure then for obesity of adults was something like 11%. Now, in 2022, some 24% of 15-year-olds were overweight or obese. Again, that's higher than the EU average of around 20%. So these rates of preventable, treatable mortality in Finland are lower than the EU average, but they're much higher than Nordic countries. Now, the most preventable cause of death in Finland is alcohol-related deaths. And again, that's a rate much higher than most EU countries, as we spoke about earlier. And also lung cancer, that's another one which is said to be preventable. But again, it's higher than none of the countries. Now, suicides and accidents also represent significant numbers of preventable deaths, especially male suicides, which are still alarmingly high in Finland and been growing. I think in the last few years that's been coming down, which is a good sign. But it's still much higher than other countries, so that's a worrying thing. So it is argued that these treatable causes of mortality in Finland include things like ischemic heart diseases, colorectal cancer, breast cancer, stroke, and other hypertensive disorders. And actually, my research shows these and many more.
I think definitely the isolation I can see is common in Finland because everyone's so independent, and compared to other, I don't know, I feel like in Italy and Greece, they have the culture where children don't move out of their family home until much later, or lots of families still live with their grandparents. And in Finland, I feel like as soon as you turn 18, people want to move out and they're in a rush to become independent. So I feel like lots of people who are struggling are probably, they live alone and maybe not as inclined to reach out for help. Added on to it's really dark in the winter times and everything else you said. But how else do you think that kind of those coping mechanisms and dealing with stress manifests in Finland to diseases and stuff like that?
Yeah, for sure. I think the culture in Finland, like you highlighted there, for sure that's a factor as well. So whenever we're talking about chronic stress can come from many different dimensions. So yeah, of course, that's a contributing factor. So I think it's whenever we think about why we develop diseases, it's very complex. Like I say, it comes from many things, and they all add up. So we have to think about, that's what chronic stress is, talking about the accumulation of many different stressors. So for sure, Finnish culture is one thing. There's even research that has argued that does Finnish culture encourage people to consider suicide? And that's something we'll come to later, which I think is quite worrying.
Well, I suppose it kind of would make sense. People joke about it. Dark winters, galsarikännit, that sort of stuff. But it makes sense. Don't they say, I don't know, this year was Finland again voted for happiest country in the world. But it's funny because every Finnish person you'll ask, they'll say, "Oh, well, that's not true."
Well, I think in the last few years, I can't remember how many years running that Finland has been voted the happiest country in the world.
I think it must be according to studies of, obviously, the government helps people out a lot.
There are many positive things about Finland, of course. Like you think about the education, the health system, which are all put up there, and other countries come to visit Finland. But I
think according to studies, they say Finland's the happiest.
Yeah,
and
of course, it
things
depends. It
work
depends.
here. But then if you're actually asking people, the average person, are they happy? I don't know if they'd say yes.
They might be a bit more critical. So, the key point there is like those studies, what metrics are they using?
Yeah, I'd like to know. I'd like to see that.
So we have to remember that even though Finland is voted happiest country in the world by this happiness index, does that include the amount of mental health drugs being sold? Because if I'm not mistaken, Finland also has one of the highest consumptions of these mental health pharmaceuticals.
So everyone's just on drugs, that's why they're happy.
No. No. You think about alcohol consumption.
Yeah, that must be high.
Well, I don't think Finland is the highest anymore. I think the actual consumption of strong alcohols has gone down, and there's many young people who avoid alcohol altogether now.
It's very trendy these days to be sober curious.
Yeah, so I think that there's things that are changing, but that's one of the interesting things, that some of these diseases are growing. So things like smoking has been going down, but then things like lung cancer, deaths and stuff like that amongst women have been going up. So to me, there's a lot of very curious trends which don't go along with previous sort of perceived wisdom about why these diseases are actually developing. So I think that as we come later on, we'll talk about lung cancer. There's a lot of myths out there about lung cancer being caused just by smoking. That's not the case. There's many other factors which contribute. Smoking is one contributing factor, but as we'll see later, chronic stress is equally important as a contributing factor to lung cancer.
That's interesting.
So to me, we have to think about, for sure, the culture has a big impact. That's for sure.
Yeah, I think could even look into that happiness index. What do they actually look at when voting Finland as the happiest country in the world in later episode? Because I'd be interested in that. Yeah,
that would be something we could discuss and see what listeners' feedback about that is, what their views about that. Is it realistic, or is it too biased, or what's going on?
Definitely.
Understand it better.
Okay, so we say there's room for improvement in Finland, but the way the healthcare system is in Finland currently at the moment, they're quite good. Can they handle the problem, or what do you think about that?
Well, the short answer is no. Dealing with chronic stress requires early interventions in mental health, not just handling its symptoms. Okay, so let's look at some basic sort of figures here. So outpatient care in Finland represents about 40% of spending. Inpatient care represents 22%. Long-term care, 18%. Pharmaceuticals, medical devices, about 13%. But prevention only represents 5%. Now we're talking, that's like a hospital care, outpatient care. That's not even getting into mental health situation. And if we see other views about the healthcare system, so centralization of specialist care resulted in huge reductions in the numbers of hospital beds from less than 3 beds per 1,000 population. And that's well below the EU average of about 5 beds per 1,000 population. And to add to that, Finland has much fewer doctors per population, something like 3.6 per 1,000 population, and many more nurses, something like 19 nurses per 1,000 population. So that's unlike the EU average. So we have shortages since 2000, has actually led to the tasks shifting from doctors to nurses in primary care, with doctors becoming more specialized in hospitals. And also these days, we also see this trend that there is much more use of temporary agency doctors, with the constant changes resulting in loss of continuity with patients. What that means is that doctors have less time to spend with the same patients. So it means they're much less aware of the history of the life stressors. And also, I think another issue here is that there's also been an increased demand for more nurses. So I think from 2010 to 2020, over that year, there's been a huge amount of huge demand. And so that's created a shortage of nurses. And I think the figures for 2022 in the first half, there was something like 8,000 vacancies for registered nurses and 15,500 vacancies for practical nurses.
Okay, so we're nearing the end of the episode. Just to summarize, what are your final thoughts?
Doctors in Finland are becoming more specialised and less exposed to the diseases outside their focal area. Some people may argue that, but to me, that's a practical outcome of what's going on in the dynamics of the healthcare system. So the key point here is that having less time to spend with patients means less knowledge about patients' background and their life histories. So by definition, you're less aware of chronic stresses. Remember, a lot of chronic stresses will not be recorded in any IT system, no matter how good they are, unless that's done with spending more time with every patient. I don't see that happening in Finland whenever they're trying to cut down times visiting the doctors. If I'm not mistaken, I think up in Oulu now, they just started going back to having personalized doctors for each patient, which I think is a good sign, because it goes back to the old way of being more aware of the patient's life histories from memory, not only reliant on what's being recorded in the IT systems. Another thing about the problem, the shift towards more nurses, registered and practical, will likely have to increase as life expectancy continues to rise in Finland. And what's more, if we think about the growth in persons 65 and over, is bound to result in an increase in the proportion of those with chronic conditions and less mobility. So like I said earlier, people over 65, you have something like over 40% of those are females and something like 31% are males. And both those have more chronic conditions. So they dementia, other disease, but also less mobility. They need help getting around. So demands on doctors and nurses will also likely increase as the population ages. That's the fact of life we can't get away from, unless we intervene more and resolve much more mental health issues earlier and more of the chronic disease and conditions. So for me, the problem is that focusing on treating the symptoms and the conditions of chronic diseases may soon resemble the white rabbit in Alice in Wonderland. What I mean by that is the white rabbit was always running on the spot just to stay in the same place, but having to run twice as fast to get anywhere else. So to me, is that the way the Finnish healthcare system is going to become? People running around like headless chickens? So we must reduce chronic stress before it adds a greater burden on the healthcare system. So that, to me, you can do that by proactive intervention in mental health amongst young people now.
Okay, great. So in future episodes, we're going to go into more detail on these topics, and
I can give a basic rundown on some of the things we can probably cover. So as I said, one of the big issues is psychological immobilization and entrapment, and entrapment going on to hopelessness. And of course, one big issue there is that hopelessness can sometimes materialize as suicide. And as I mentioned earlier, some research has mentioned that, and asked the question, does Finnish culture nurture suicide? I will go through that in the podcast with immobilization and entrapment. I guess if we want to focus on many of the different situations about what chronic stress is doing, One of the big issues is the role of child-parent interactions. That's one of the big factors in early life experiences, which can lead to many of the chronic stressors from mental health issues. We could also look at the role of emotional stress in asthma. We can also look further in the immune system with things like rheumatoid disease, like rheumatoid arthritis. There's also ALS. We can look into that. So the amyotrophic lateral sclerosis and also multiple sclerosis in Finland. In actual fact, there's many cases. There's been clusters of these diseases found in different parts of Finland, such as western coast of Finland, or the west side of Finland, and also eastern Finland in South Karelia, which seems to be related to the evacuees from Karelia during the Second World War. There's some interesting studies there with some interesting findings, which I think people will find interesting, since the amount of Karelians evacuated was 400,000, and now we have big amounts of these diseases such as MS and ALS. There's also a big issue with diabetes, but of course we can have a look at that. And there's also, we can look at emotional repression related to the chronic stress of developing breast cancer and lung cancer. And finally, we can look at dementia such as Alzheimer's and how chronic stress leads to that.
Perfect. So that's it for today. Thank you very much for listening. Please do let us know what it is that you would be most interested in hearing about more, and we can definitely delve into them some more.
Yeah, thank you for listening. And of course, we're welcome to field any comments and suggestions. So please,
constructive criticism.
Yeah.
Yeah. Okay. Thank you so much for listening.
Thank you.
Speak to you next time.
Bye for now.